Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Dermatology. I'm Stephanie Talea with Practical Dermatology magazine. A recent study published in JAMA Dermatology was conducted to examine potential financial conflicts of interest and characterize disclosure practices among dermatology patient advocacy organizations. For this cross-sectional study of the largest dermatology patient advocacy organizations, researchers used the Kaiser Health News database to acquire data on total revenue from each organization's Form 990 for the year 2015. Tax forms and annual reports from 2017 were used for two organizations that were missing donor information for 2015. The researchers also manually examined annual reports, websites, and LinkedIn profiles to track donations and determine disclosure practices pertaining to financial support and board membership. The researchers identified 24 dermatology patient advocacy organizations with annual revenues greater than $500,000. 5 of these had total donations that exceeded $5 million, and 4 reported industry donations that exceeded $500,000. 2 groups reported that at least 40% of their total donations were from industry sponsorship. Overall, 17 organizations reported receiving donations from industry on an annual report or organization website, and 12 reported the amount of donations in ranges. 3 organizations reported having a current or former industry executive on its governing board, on its website or annual report. When this search was replicated using LinkedIn, the researchers found at least 54% of the organizations have a current or former industry executive on their boards. The study authors concluded, these findings suggest inconsistent disclosure of industry-derived financial support and board membership that may represent conflicts of interest. Policies that support the transparency and consistency of disclosure practices between industry and patient advocacy organizations appear to be needed to fully characterize the extent of conflicts of interest among patient advocacy organizations in dermatology and maintain trust in these important institutions. Treating psoriasis with biologic drugs can reduce the early plaque buildup that clogs arteries, restricts blood flow, and leads to heart attacks and stroke, according to a study funded by the National Heart, Lung, and Blood Institute that appears online in the Journal of Cardiovascular Research. Classically, a heart attack is caused by one of 5 risk factors: diabetes, hypertension, high cholesterol, family history, or smoking, says Dr. Nehal Mehta, head of the Lab of Inflammation and Cardiometabolic Diseases at NHLBI, in a news release. Our study presents evidence that there is a 6th factor, inflammation, and that is critical to both the development and the progression of atherosclerosis to heart attack. Now researchers provided first-in-human evidence that treatment of a known inflammatory condition with biologic therapy was associated with a reduction in coronary artery disease, in particular of rupture-prone plaque, which often leads to heart attack. The current findings came from an observational study of the NIH Psoriasis Atherosclerosis Cardiometabolic Initiative cohort, which had 290 psoriasis patients, 121 of whom suffered moderate to severe skin disease and qualified for the biologic therapy approved by the FDA. For a year, researchers followed the eligible patients, all of whom had low cardiovascular risk, and compared them to those who elected not to receive biologic therapy. Study results show that the biologic therapy was associated with an 8% reduction in coronary artery plaque. Prior research had linked psoriasis with premature development of high-risk coronary plaque. Now, Dr. Mehta's team has shown beneficial changes in this plaque when psoriasis is treated with biologic therapy, even without changes in other cardiovascular risk factors such as cholesterol, glucose, and blood pressure. This appears to be an anti-inflammatory effect. In the absence of improvement in other cardiovascular risk factors and without adding new cholesterol medications, patients' soft plaque still improved. The only change was the severity of their skin disease, says Dr. Mehta. Researchers say continued research will be needed to confirm whether this is so or whether the positive effect is a result of treating the underlying inflammatory disease. Our data are observational, so the next step should be randomized controlled trials, concluded the study. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Dermatology.